Welcome back to the Feeding Pod. Tova and I are really excited because we have kind of the other part of the mini series that we're wanting to be starting. So if you haven't already listened to our first mini series, which is where we are reviewing products that you may or may not need, or products that we may or may not recommend for feeding therapy, this one's a little bit different. It's a little bit spicier, if you will. We are going to be talking about, shit we've seen on the internet. Things that we've come across that people are making claims about or talking about or, trying to sell you, just anything we've seen on the internet related to pediatric feeding or swallowing. And we're going to break it down of what's the science actually behind this? Is there, some possibility that this could be helpful, or is this something that we need to just put away and not? Hi, welcome to the Feeding Pod. I'm Bri.
And I'm Tovah.
And we're speech language pathologists with a clinical focus in pediatric feeding and swallowing disorders.
Whether you're in the community, outpatient, or hospital settings, we're here to talk all things peds feeding.
We dive into the research, discuss nuances of clinical care, and share experiences that are valuable to both clinicians and caregivers alike.
We also spend time debunking feeding misinformation and help you find ways to filter out all the noise on social media.
We're so excited you've decided to give the Feeding Pod a listen.
Hope you enjoy!
So our goal is to share something we've seen, talk you through a post that we've seen, something that we've come across on social media, and then actually break down the science behind it, but also talk the nuance behind it too. Because some of these things might be I don't know about the science side, but could it have a place somewhere? And where does it fit? And how does it maybe not fit? Or all the ins and outs of that. So I'm really excited about that. The second thing that I want you to know about this mini series is that Tova and I don't know what each other are talking about. So just like with the product reviews, we are coming in here and it's been totally anonymized. I don't know what Tova is going to share with me, and she does not know what I'm going to share with her. So we're going to be kind of live reacting to that, which is going to be fun. This is going to be really, really fun. Anything else to add, Tova? Do you feel like I covered all the things for this?
I feel like you covered everything. Mine is a product that I saw on the internet.
That's okay. Mine's kind of a product / therapy technique. It's a thing, but it's used therapeutically.
Yeah, as you were describing it, I just wondered if I broke the rules. But I think we're okay. We're good.
No, I think you're fine.
Yeah.
I don't think there's rules.
Okay.
You've seen it on the internet.
Enough parents or therapists ask me about, then I investigate.
Yes. Yeah, exactly. Yeah, that's the thing too. If you see something and you're man, I wish they would talk about this thing that I've seen on the internet or these claims that are being made, make sure to message us, DM us something.
Yeah.
Because if we get, a couple of things that we're ooh, that's interesting, or maybe it's something other people have asked us about in the past too. We're you know what, let's just talk about this one. So
yeah, and helpful tools as well.
Yeah. Some of them might, that's what I'm saying. We're just going to talk about it. Some of the things might be this actually could work. And here's where we would maybe consider it.
Do you want to go first or do you want me to go first?
I don't know. I was trying to think of who went first last time. I think you went first last time.
I don't know. Yeah, go for it.
It matters, but okay, I'll go first. All right. So the thing that I'm going to talk about is kinesio taping. So that is a thing that I've seen, I see a lot of when I'm in my doom scrolls, but also that I've had people ask me about, where they're my doom scrolls, where they say what's the merit behind this, right? Kinesio taping. We see it, especially with some of our colleagues, right? Our PT and OT colleagues will use it. You may have seen people use it for big muscles. So on their legs, I've seen people use it, or I've seen people use it on their arms or biceps. For what reasons on that end, I don't know. That's not what I'm here to speak about. But what I'm seeing is more people using it, quote unquote, right? Improve oral dysphagia or even swallowing, improve pharyngeal dysphagia. Okay. So
I really want to look at pictures of that. What does that look like?
Correct. What does it look like? It looks like tape on your face and throat. That's what it looks like. Now, I wanna talk through this part now. So the post specifically that I came across that made me be yeah, you know what? We're gonna talk about this. Okay. So this person, I'm looking at the post right now. I'm gonna real quick. If you're watching the video, you might be able to pause on it. But yeah, not trying to call, any account out or anything like that, but just the practice of it, right? We need to talk about these things. So this one says, trying out kinesiology tape on the orbicularis oris muscle to help with lip closure and decrease drooling. So there's a kid sitting there who looks probably 4 years old maybe. And they're putting tape, just like the video is them putting tape, Kinesio tape, around the child's mouth. And they're like, try out Kinesio taping and it can, decrease drooling and help with XYZ and all this stuff. And the thing is, I feel like as much as, this is what I'm trying to say, as much as we like would love to have something like putting tape on the mouth be something that like helps a child stop drooling, it doesn't. It's just not the thing that does it. So, I feel like this is one of those things sometimes where we're like, too good to be true probably is sort of said. Yeah. But here's the thing with the science breakdown. So like, okay, right. Seeing those claims, I'm like, interesting. I'd love to, learn more about that. The biggest thing is like with the studies, and I'll talk through some of the studies. I got them over here on my other screen. I'll talk through some of those in a second, but overarching theme that I kind of what we have from reviewing a bunch of different studies is, sure, if you use it in conjunction with other things, like you think it might like supplement something, fine. But there was actually a recent systematic review in 2024. I'm just going to go ahead and pull that one up so I don't cite it wrong. Okay. But it was by Shamsoddini and colleagues. Oh no, that's the wrong one. Sorry. Hold on. Time out. Here it is. So let me pull up the systematic review that was really recently done. Okay, so this was scoping review that was done by Golami and colleagues, and it's a scoping review on the effects of kinesio taping on oral pharyngeal function related to swallowing and feeding. This was in August of 2024. So fairly recent. And really what they say is that this is literally quote, from the conclusion is that there's not enough evidence to add kinesio taping to our usual management of feeding and swallowing disorders yet. And a lot of that comes down to the fact that the studies, the designs of them are really poor quality. So even the studies that claim it helped with drooling, and these are a lot of claims like drooling, oral feeding skills, infant feeding, like sucking, immediate activation of swallowing muscles. Yes, for infants and preterm infants. Yes. I know. Management of dysphagia in patients with stroke or CP, those are kind of the broad themes around it. The studies that are done that even show some effect are very, very poor quality. But when we look at the higher quality studies that we have, like those randomized controlled trials or these scoping reviews, it is showing that there's really not much effect. And if you think about it, right, if I was to, this is so cheeky of me to say, but do you remember when people around Christmas time with the Grinch, people will tape their nose up like Cindy Lou Who?
Yeah. I don't know if I've ever seen anyone tape it, but
Okay, so I've seen people do it when they dress as Cindy Lou Who, or they tape their nose up. I'm literally doing it on video right now if you're listening. But if I do that, as soon as I remove the tape, what happens? My nose goes back down to the way it was. And so that's kind of how this kinesio taping comes into play. It's sure, if you pull a child's cheek muscles up and put tape in, it's gonna make them more retracted. Or you pull it down and you tape their face all the way across down to their lip, or you take their bottom lip and you tape in an upward to try to help with drooling.
They solve your wrinkles. Have you seen those?
Yes. Oh my gosh, those big pads.
You tape it and you try to I get targeted for those a lot.
I get targeted for those too. I'm like, okay, thank you. I know I've got them. But the thing is, it's all temporary, right? As soon as you remove the tape, give it a second, give it a minute, and it's going to go right back down. Right. So in a lot of those studies, it's it helped with drooling because it held that lower lip upward.
While the tape was on.
And
then the effect after, it's not.
You the effect after most of the time. That's the thing about the studies is they're when they used it for 2 weeks, the parents reported drooling decrease. And it's well,
I wonder if part of that too is just because when you think about children as they get a little bit older and they're having challenges with drooling, it can be for a lot of different reasons. And for some kids, helping bring their awareness to it helps with drooling, and it helps them, know even if they need to wipe it or they need to do a sweep with their tongue or whatever. So I wonder if the tape too just helps with that awareness. But little itty bitty babies, I have a hard time wrapping my head around that. And then I also just keep thinking about when you have to take the tape off. Like if I have to take a Band-Aid off of my daughter,
Right.
it'd be like hanging by a thread and it's like I'm amputating her leg.
Right. And I'm pretty sure with a lot of these, like the tape is not removed every single time.
They're just walking outside with tape around their lips.
Right. Yeah. And so that's the other thing too. Like we're thinking, right? We always want to think like functionally. And if this is not helping with long-term changes, right? Like, and that's another thing. A lot of these studies that use kinesio taping are doing it alongside like function-based activities and function-based exercises. So like they're doing it alongside cueing to swallow their saliva or, you know, doing things like advancing or improve, like working on practicing swallowing or weaning their, you know, like I'm giving examples. Those aren't real studies that have gone, but like alongside of, because the studies of course don't tell you exactly what they did, which is also a problem. Like if it's not repeatable, that's a red flag for a study. But I say that because it's like, it's always in conjunction with other exercises.
Right.
But when it's not showing any difference. Like traditional therapy.
Well, it makes sense because it reminds me of modalities where we do stuff to children and it's a passive stretch or a passive whatever, a passive movement versus when they're the ones driving the boat. It's very different.
Doing it with them and really guiding that. Yeah, I totally. And like, if you think about it, it makes sense that like, we can't change tone, right? Hopefully everyone listening, like we can't change tone. We can support strength and range of motion and coordination surrounding that. But ultimately, like we can't change the tone of a child. So I'm thinking specifically with cerebral palsy populations, I feel like unfortunately they get targeted for a lot of these types of like ensomes and, you know, all these different things to try to like, oh, they have low tone or they're hypertonicity and we have to fix their tone. And it's like, we still need to do it in a very functional manner, following motor learning principles. But things like the kinesio taping, like by taping their mouth, you know, the bottom lip upward, sure, temporarily you might see some decrease in drooling, but what is it doing functionally long term? And two, I think we really also have to check like with our like ableism and recognizing that like there can't, like if they're drooling, but there's not functional pieces impacted, right? Like it's not actually a child who's anterior spillage while eating, or, you know, there's different things too, where it's like, is this something that like we have to push to manage? Because where's the like, okay, well now the child just has tape on their face all day long. And like, how does that play a role too?
Yeah, I think it could be somewhere in the middle. Because like I said, drooling can happen for so many reasons. So it's worth exploring, you know, like, is it happening because it's like allergy season and they have seasonal allergies or tonsils and adenoids, or is it tone, or is it, you know, a combination of whatever.
Like a child who is aspirating may
and doesn't want to swallow. Right. And so it's like, if you're not getting at why they're doing it, then I have a hard time. The intervention has to match why it's happening. So, and even like what you're saying, if you're taping the bottom lip up because the bottom lip is weak, but they're not actually activating those muscles themselves, it's just, I don't know.
It's
yeah.
Like, I feel like if we, you know, potentially compared it in the PT world, it would be like someone taping their muscles like on race day, but not like doing the physical therapy work in between or during training to actually re-strengthen those muscles or like heal those muscles, right? It's like, okay, sure, I use it while I'm running, but then I make sure to like do all my other exercises. So hopefully like I don't have to use that, right? Like, do we like potentially, does it have a place in a like stability sense to help sometimes, but not all the time? Because I do recognize that like taping would be fairly like low risk if we're thinking like, you know, oh, could this potentially have a place in my toolbox? Like potentially low risk, maybe some like facial irritation, or like if a child is super averse to something, of course we would want to back off and not use it. But it's like, could it be low risk to help a child start drinking from a straw and then we wean it away? Like I can hold some space for things like that.
it's not going to harm and it's something that a family really wants to try, I can
Yeah.
see it, and it's not like upsetting the child and they're not like ripping it off and causing like wounds to their
Right.
face, then I can see it, like, why not? And I would be curious to talk to like OT and PT colleagues too who do use kinesio tape in other ways and find it beneficial, and like why they find it beneficial and how they use it, because I know it's used by modalities for different reasons.
Yeah, which goes back to what you were saying about like, well, we have to know why we're using it to begin with. So we don't understand why we're even trying. Like, we're just like, I've just heard about this thing. Like, let's just throw it on any kid. Like, that's a problem.
Right. And I do have to say one thing that I forgot until you said that, the why, because you mentioned pharyngeal dysphagia and like placing tape on the neck. Yeah. And it reminds me of vital stim. And so we have to be really mindful that you're taping superficially something that happens very much deeper in the body. And that if you're doing something for a pharyngeal phase impairment like taping, then I would want to make damn sure that we tape during swallow imaging and see if it's make sure it's helping. Because
thinking like if a child has difficulty like managing secretions, for example, like I don't want to tape and force everything to flow back. Like they may be having spillage because they're trying to say, I can't handle this. This is too much, which, signals like, okay, let's go to ENT. Like, let's talk about options for like reducing secretions, because maybe that is an issue here. Or like, what medications are they on? Is that causing some of this down the line? And shout out to our pharmacist episode and go back and listen to that, like, because there is so many layers to it. So I think, for me, the reason that I brought it up and the main reason that I get irritated is because, the claims that are made about it, like, helping with lip strengthening, or just the overarching thing, like decreases drooling. It's like, okay, but decreases drooling for who? For how long? Like, what's the protocols behind this? What else was maybe done? And like all those other missing pieces, like the way that it's often presented, that's really irritating. And I'll be sure to link the studies that I talked about in the end of this episode, so if people want to read further on it. But like all in all, it's just like the studies are not showing anything's maintaining long term. It's always in conjunction with those more active based interventions. So yeah, it's not necessarily, it's not.
Yeah. And I'm critical of anything that's like a one size fits all, because we just know that for any of these kids, it's like a little puzzle, and it's, and we have to use our critical thinking skills.
Yes. But yeah. Okay, that's the one that I had. I think this was a good discussion about it too. This is what I'm talking about. Like, there are things where it's like, oh, there's like a nuance here. Like, where we have a place sometimes, somewhere, with some child, with some family for this one specific, like instance. Maybe, like, we don't ever want to totally write off stuff, but odds are pretty low, is what we're saying. Okay, Tovah, hit me with what you brought.
All right, so it's a bottle that claims, like, I think all bottles claim to be just like the breast. I think that's pretty standard. I think they all say they're anti-colic. They all say they're slow flow in some version of, some iteration of the brand. But this bottle, they do, they'll take a picture, like a 3D image of your nipple. And there's 5 nipple options. So you can try to match your nipple to the bottle nipple. And then they also have 5 skin shades. So you can match. Your face froze in the best.
Please be unfrozen.
You're like, your eyes were like rolling back in your head.
Just trying to understand. So
wait, I haven't told you everything about the bottle, but ask me something.
Okay, but so far it's matching nipple shape.
Correct.
And color.
And color, yeah.
Breast color.
Correct.
Okay.
And then the other thing is, we know with breastfeeding that there's more than one hole that the milk comes out. And so with this bottle, there are many holes. And you can like adjust for like what it would feel like for a letdown, or like this is what it
is. It coming out all of the holes every time?
It comes out all the holes, yeah.
The breast, it doesn't come out all the holes the whole entire time.
Yeah, and there's like different adjustments to it too. So basically there's 25 iterations of the bottle. If you think about 5 nipple sizes, 5 colors, and then within that you can like adjust the flow. It sounds so this bottle came across my
I've literally never ever heard of this or seen this.
I heard of it multiple times because I work with so many moms whose babies are breastfeeding well and not taking a bottle. Yeah. So so far it hasn't helped any of them. I'll start there. It has I want to say it's like $30. I'll look at the website really quick. I'm pretty sure it's $30 for one bottle.
How much does the imaging cost? Like for all of that?
No, you don't have to pay for it. It's $39 for one classic bottle, and then there's like a starter kit for $55. There's two different ones. There's like an anatomy bottle, which is the one where you try to match it to your boob, and then there's the classic bottle that's like
how much is the anatomy one?
They're both $30.
For $39.
$30 for one bottle, $39 for the glass one.
Okay.
But here's the thing. If your baby likes this bottle and it fits in your budget and it works, whatever. But for someone to think that this is going to be the magic bullet,
right,
is not.
Immediately
disappointed. And it's also been refuted in literature. Like there is no such thing as nipple confusion. So like you don't have to worry about your baby. If your baby prefers breast over bottle, it's because for some reason they prefer your breast over the bottle, just like if they prefer the bottle over breast. And you would have to, again, critically think and figure out why that is so that you know how to help. But the other thing that I found interesting, because I was deep diving into who works there, who develops this. And I didn't find, and I might have missed it, but I didn't see a single speech pathologist, feeding therapist, IBCLC on their site as far as their medical board, as far as their advisors, whatever. So I found that really interesting too.
Well, I think immediately for me, when I was like, okay, so it matches like the nipple and the color, but immediately for me, I was thinking like breast, like malleability.
Well, yeah. So are you matching your nipple when it's fully extended in the baby?
Right. Like a full breast, a slightly emptied breast. Like where's the nipple? Yeah. Like, and
is it my boob at 1 a.m.? Is it my boob at 4 p.m.? Is it my boob and because you nap too long? Like, yeah.
The compression of the tissue in comparison to the compression on a
I think it's, I know. Yeah. So,
which are not things that as a parent without any background in feeding, in breastfeeding and bottle feeding, would you think of, right? You would think like, oh, let's match the nipple and visually make it as close as possible. But there's so many other factors.
And the other thing is it would be really hard to know when it comes to flow rate. That's such a big factor in how we feed babies. So the flow rate piece for me is like a big question mark too. And it doesn't mean that your baby's going to do better or worse in life or in feeding in general if it's more or less like your boob.
Right.
So, I mean, in general, like we definitely want to think about nipple shape and flow rate. And we definitely want to think about those things, but it's not going to be more or less beneficial if it has like the same number of holes as your boob or if it's the same.
Yeah. And in comparison, like these are two different skills, right? Like I almost go to saying like, you know, the straw cup you choose is not like, if we're thinking about like breast to bottle or straw, like it's like these are three different skills in the same way that choosing a bottle versus breast to choosing like a straw versus breast, right? Like yes, it's using sucking slightly closer to breast than straw drinking is, but ultimately like it is using a different skill set, like different neural pathways are being used. And I think too, like the biggest thing that you said is when we have these families that are desperate for like, I can't get them to take a bottle, specifically in the cases of I've been nursing and I cannot get them to take a bottle. I would go to say a very large percentage, anecdotally in my practice, I'd have to search if there's a study on this. I would say like almost 90% of the time, it's preference. They just were not introduced to the bottle very early. They have a preference to the breast, and that's what they want. It's not the bottle specifically.
Right. Yeah. No, I know. Like I mentioned, I work with a lot of families in this situation, and they'll come in with like a duffel bag of all the different bottles that they've tried. And there isn't like thinking that, and I totally get it, like they're going to find the magic bottle that fixes it. And it usually is like so much more to it than that. Yeah. And I would say like a lot of times those babies end up taking bottles.
Oh yeah. Yeah. I would say a lot of them also end up taking,
but not this bottle. I haven't had success yet with this bottle. But they have like I want to say it's like a 30-day money back guarantee. Families will be like, well, I'll just buy it and like we'll return it.
But literally just even like dealing with the return process.
Oh yeah.
You know,
I know. Like, I did a deep dive and the owner says that only 1% of people return it. And I was like, 100% of people I've known who have bought your bottle.
Right, well, and that's the thing, like, but did they just not meet the 30-day deadline, not go through the process, forget to drop it off at the, mailing? Like, they're obviously parents, like, in the early stages of infancy, which is like, I'm barely making a return.
Yeah.
So.
You're in it right now.
I am in it right now, and we're lucky that Amazon gives you like 45 days to submit a return because it wouldn't be making it there early enough. And that's like, during the period of them trialing it. So it's just, that'd be a little bit tough. That's so interesting though. I have not seen this one. Now I probably will. My phone's probably been
I'm going to send it to you when we get off the recording. You can look at it and tell me what you think. Because again, we're not trying to call people out by name or like.
No.
Hear how we think about things and like because when the first mom brought it in, I wasn't like, what the heck is that? Get that out of here. I was like, that's really interesting. Let's try it.
And I think too, like, I'm like, okay, I like how they're trying to be like, like, to me, it sounds more like a hypothesis. Like, if we match this, does it help or does it not help? But they just went with, it's gonna help. It doesn't.
Yeah.
So. Interesting. I'm also going to link the nipple confusion, it's not nipple confusion article by Dr. Zimmerman.
Oh, yeah, do that. That's a great idea.
I'll link that below so that anyone that wants to read about that, like,
basically
nipple confusion is not a thing.
And it also doesn't necessarily mean there's anything wrong with your baby, too. I see all these babies that go to, like, sometimes there is, like, sometimes there's something going on that we have to work through. But, like, when you were talking about preference, I think it's important to say that because they'll go to all this therapy and all the.
That's the thing. Like, I prefer cups with a straw. My husband prefers open.
Yeah.
Like, we have preferences and it's okay. Now, like, there's certain situations where, like, okay, baby, we need you to be taking something else because going back to work, or, like, I want to be able to have a girls' night and, have somebody watch baby for a little bit, whatever it is. But, like, preferences are a thing. And it can feel, in those moments, it can feel really, really hard, which I think is, like, that marketing that irritates me. Because I'm just like, it's really predatory and these people are really desperate, like, and need it. And so I don't like that side of it. But
I will say, this product, I read like the background and it sounds like it came from a place of like wanting to help based on their own experience. So like, I do think like it wasn't, the intentions were not predatory on the outset, at least. I don't know if they are now, but.
Yeah. Well, I think that's, then you start to get like the business marketing people who don't understand like the nuance of working with some of these families. And then that's where marketing can not be so nice. But interesting. Well, this was fun. I'm glad we got to talk through these things. And I hope it was helpful for anyone listening to just kind of hear how we think through some of this stuff and how it is not black and white. It's not like full on yes, full on no. Like there is some nuance in here. And that's what helps us to actually implement evidence-based practice, is to like look at the science on all these sides and then say, but a family comes to you and really wants this or wants to try this, or, what's the why behind it? Like there's so much nuance in there that we then have to filter through. This was fun. I'm excited for the next one already.
Yay, me too. Do you have one in your head already?
No, I'm just excited to talk about one. I feel like I have a running list of things. So cool. Well, till next time. Bye.
Thanks for listening to the Feeding Pod.
Be sure to follow us on social media at Pediatric Feeding SLP and at Pediatric Feeding Partners.
And if you liked this episode, be sure to leave us a 5-star and a review.
Till next time.